If you have a bulging disc, you've probably been told to stretch your back, straighten your core, or hang from a pull-up bar to decompress your spine. Yet, many people do all these things and still deal with back pain, sciatica, numbness, or symptoms that just keep coming back. Now, one of the biggest frustrations I hear from our patients is that they feel like they're doing everything right, but their disc never seems to fully settle down. Does sitting make your symptoms worse? Does your lower back feel like it's always tight? Or have you tried exercise after exercise without getting lasting relief? If so, the problem may not be the disc itself. It may be a muscle that attaches directly to your lumbar spine and quietly increases stress on an already injured disc. That muscle is called the psoas. In this video, I'm going to show you how a tight psoas can silently worsen a bulging disc and the 3 fixes you can start tonight and why the psoas release gives the injured disc room to breathe. Hi, I'm Dr. Tam Lee, chiropractor here in San Jose, California. The psoas is different from nearly every other muscle in your body because it attaches directly to the lumbar spine. It starts along the lower vertebrae, travels through the front of the pelvis, and connects into the upper thigh. That connection gives the psoas tremendous influence over what's happening in your lower back. Think about how many hours you've been sitting each day. The psoas stays in a shortened position the entire time. Over months and years, it can lose flexibility and begin pulling on the very area where the disc bulges occur. That helps explain why symptoms keep returning. When the psoas becomes chronically tight, it doesn't just affect the hip. Because it attaches directly to the lumbar spine, it can pull the lower back into a deeper arch and tip the pelvis forward. That changes how force moves through the spine. The lower discs, especially the L4-5 and the L5-S1, already carry more load than any other disc in the body. And when a tight psoas continues pulling on the spine, those joints can become compressed even further. The front of the disc is squeezed. Pressure inside the disc increases and the disc material is pushed towards the back of the disc where sensitive nerve structures are located. If you have sciatica pain traveling down your leg, numbness or tingling, this becomes especially important. More pressure on an already injured disc can mean more irritation around the nerve roots that eventually form the sciatic nerve. This helps explain why people stretch, strengthen, and stay active, yet their symptoms continue to come back. The pressure affecting the disc may still be there. And if that pressure is being driven by a tight psoas, learning how to release that tension becomes an important part of recovery. Psoas release gives the injured disc room to breathe. Now that you understand how a tight psoas can increase stress on an injured disc, the first goal is not stretching. The first goal is creating stability and reducing tension in a way that doesn't aggravate the lower back. And that is what this first exercise is designed to do. It's called the Psoas Isometric Floor Press. This exercise combines core stability with controlled hip flexor contraction. That combination helps to calm an overactive psoas while improving support around the lumbar and pelvis. Start by lying on your back with both knees bent and your feet flat on the floor. Press your lower back gently into the floor so there's no gap beneath it. Lift your left knee until your hip is bent to 90 degrees. Place your left hand on top of your left thigh, just above the knee. Push your thigh towards your chest while pushing your hand against your thigh with equal pressure. Your leg should not move. Hold that contraction for 10 seconds while breathing normally. Relax and repeat 10 repetitions on the left side, then perform 10 repetitions on the right side. Rest if needed, and then as you become stronger and more stable, work up to a total of 3 sets. You should feel your abdominal muscles working and a gentle effort deep in the front of the hip. Your lower back should stay comfortable and supported throughout the movement. By activating the muscle that helps to stabilize the spine, this exercise can reduce some of that tension that builds up around a chronically tight psoas. That is an important first step because a muscle that remains guarded and overactive is a muscle that is much harder to lengthen safely. Remember, psoas release gives the injured disc room to breathe. With the spine better supported. The next exercise focuses on encouraging pressure to move away from the irritated area. Exercise number 2 is the Cobra pose, also known as the full prone lumbar extension. Now, this exercise is valuable for 2 reasons. First, extension-based movements are commonly used to help reduce pressure on a bulging disc. If you are familiar with the McKenzie's method, you'll recognize that extension exercises are often used to encourage disc material to move away from sensitive nerve structures and back towards the center of the disc. Second, as you press up into an extension, you're also placing the psoas into a lengthened position, and that gives you an opportunity to begin releasing tension in a muscle that may be increasing stress on the lumbar spine throughout the day. In other words, you're working on the disc and the psoas at the same time. Start by lying flat on your stomach with your legs extended behind you. Place your hands underneath your shoulders and keep your elbows close to your sides. Slowly press through your hands, lifting your head, chest, and upper abdomen off the floor. Keep your hips and pelvis in contact with the ground throughout the movement. Only go as high as you can comfortably tolerate. If straightening your arms causes discomfort, stay on your forearms instead. Pause at the top for 3 seconds. As you hold the position, you should feel a gentle stretch through the front of the hip where the psoas runs. You should not force the movement or push into pain. Slowly lower your back down. Perform 10 repetitions. Rest if needed. Then, as your symptoms improve and the movement becomes easier, work up to 3 sets total. Some people will notice discomfort moving out of the leg and becoming more centered in the lower back. That can be a positive sign that pressure is becoming less concentrated around the nerve. Stop if symptoms travel further down the leg or worsen. This exercise helps address 2 of the biggest problems we've discussed. It can help reduce disc pressure while beginning to lengthen a chronically tight psoas, and it gives the injured disc room to breathe. And when both of these things start happening together, the goal becomes much easier to achieve. The final exercise focuses on isolating the psoas even further so you can lengthen it without placing additional stress on the lower back. Exercise number 3 is the lunge stretch. The first exercise helped to improve stability around the spine. The second exercise helped to reduce pressure inside the disc while beginning to lengthen the psoas. Now it's time to focus directly on the muscle we've been talking about throughout this entire video. This exercise is designed to lengthen the psoas without placing unnecessary stress on the lower back. Now, one mistake I often see is people turning a hip flexor stretch into a lower back stretch. They lean forward, arch their spine, and end up placing more compression through the very area they're trying to protect. The setup makes this exercise effective. Start by kneeling on your right knee with your left foot flat on the floor in front of you. Both knees should be bent approximately 90 degrees. Keep your chest tall and your eyes looking forward. Before you move, squeeze your right glute and tuck your tailbone underneath you. Think about bringing the front of your pelvis upward. You should feel your lower back flatten slightly. Now slowly shift your body forward a few inches while maintaining that position. You should feel a stretch deep in the front of the right hip. That is where the psoas runs. If you feel the stretch mostly in your lower back, reset your position and focus on maintaining the tailbone tuck. Hold the stretch for 10 seconds. Perform 3 holds on the right side, then switch sides and perform 3 holds on the left side. Move slowly and breathe normally throughout the entire stretch. The goal is gentle, sustained stretching, not forcing your way into a deeper position. By this point, you've stabilized the spine, reduced pressure on the disc, and you're directly addressing tension in the psoas itself. Trying to aggressively stretch a tight psoas before creating stability can sometimes irritate an already sensitive back. By approaching it in this order, you're giving the muscle better opportunity to relax while keeping the spine supported. Today, you learned how a tight psoas can increase stress on a bulging disc and why so many people continue struggling with back pain, sciatica, numbness, and recurring symptoms despite trying common treatments. More importantly, you learned 3 exercises that work together to address the problem. The Psoas isometric floor press helps to improve stability around the spine. Cobra pose helps to reduce pressure while beginning to lengthen the psoas. The lunge stretch directly targets tension in the psoas itself. When you put all three of those exercises together, you're addressing the same problem from three different angles. Improve stability, reduce pressure, and release tension. And that's the reason this approach can be so effective. A tight psoas can continue pulling on the lumbar spine and increasing stress on an already injured disc. When that tension starts to come down, pressure in the disc can come down with it. Psoas release gives the injured disc room to breathe and heal. If you follow along with these exercises, which one gave you the most relief? Was it the Psoas isometric floor press or the Cobra pose? Drop a comment below and let me know. If you found value in this video, please give it a like and share it with someone dealing with a bulging disc or sciatica. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel better. Remember to subscribe if you want tips on how to protect your spine, better understand your condition, and learn treatments that help people find long-term relief. If you'd like to learn the best exercises for an L4-5 and an L5-S1 disc bulge, go watch this video next. I'll show you how to reduce pain, improve movement, and support long-term recovery while helping you avoid some of the most common mistakes that keep symptoms coming back.